So, what are some of the ways that your program has been able to integrate support for survivors who use substances?
One of the things that we've been able to do recently is hire a therapist that is trained in working with clients who use substances and is able to provide both individual therapeutic options as well as group therapy, but then also really work with training our staff on issues related to assisting clients who use substances. And so that has been an invaluable resource for us. One of the other things that our clinical director has been working on is um, teaching about the ways in which survivors intersect through these populations, where you may have survivors with mental health concerns, but then also be using substances. And so, how does all of that interact? And what can we do when we are meeting the needs of survivors to acknowledge all the things that they may be facing? And then what can we identify in terms of supportive services to help those survivors get where they're trying to go?
And then, so when you're offering these different services, how do you balance that with making sure that your program is still low barrier, really accessible, and that everything is based in voluntary services?
So in terms of we toyed with the idea of asking about people like, are you using substances on crisis line? And we understand that survivors may use those and we want to be able to support you with that. But then we realized that if I was a survivor and I was using substances, I would say, no, 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 I don't need that. I don't need that help, because I would interpret it as a barrier, even though it wasn't meant that way. So we don't ask that question on crisis line or anything related to that. But once a survivor comes into shelter, we really just do like a needs triage. And so we ask about everything. Is there something we can do to support you around reconnecting with your family if that's something that you want? Is there something that we can do to help you around, of course, basic necessities, food, clothing? And so including the substance question in a like kind of a triage of questions, we think removes some of the stigma, because it's right up there with, do you need clothing? Do you need feminine hygiene products? Do you just asking it as one of the things that we can help with, one of the things we want to help you with, instead of making it its own conversation, we think helps remove some of the stigma attached to it. But then also, we have really been working with our local substance abuse center on creating a trauma informed program, for them to create a trauma informed program for survivors. What we realize is, like, we can create these wonderful supportive networks internally, but what are survivors when they exit shelter? What are they exiting to? And so we are trying to work with them to create a trauma informed program. And unfortunately for us, but fortunately for the community, they poached some of our people to help with that program. So we are looking forward to what we are going to be able to create collaboratively with them to try to address these needs. And then also, one of the other ways that we have removed the stigma is just by talking openly about it amongst ourselves. So just treating it as if it's just another thing. So it might be when you're going through your daily transportation list, like, oh, we have to take Miss Smith to the doctor and Miss Jones to the dentist and Miss Myers to the methadone clinic. Just treating it like it's just normal, like just part of the services we provide, and that has gone a long way, I think, to try to remove some of the stigma for survivors.
Yes. So, really approaching it like any other dimension of health and well being, uh,
Mhm.
and just any other kind of holistic need that someone might identify for themselves.
Mhm.
And the way that we talk about substance use amongst people working within a program, that mirrors the way that then we interact with people. So I like to often say that, like, we always talk about people as if they're in the room sitting right next to us, right? And that really models the frame of mind, the perspective, and the way that we approach people who are experiencing really highly stigmatized situations that are completely valid trauma responses for many people.
And realizing that when you when people come into your program, the sum of what has happened to them is more than whatever incident they disclose to you on the crisis line. And so for a lot of people, you're dealing with years and years of trauma and abuse. And that if you think about it in that perspective, using substances is a totally reasonable way to deal with some of the things that they have gone through. And so just looking at it as this was a coping mechanism that they chose. And so what can we do to support them in developing healthy coping mechanisms, and what would that look like? But then also realizing that it's their choice. That what I mean, one of our big things in shelter is if you use substances, as long as you're not a danger to yourself or others, we're not here to judge what you are doing. And so as long as it doesn't, you don't create a danger in the shelter environment for other people, then we try to be extremely understanding about what residents may be going through.
Yes.
Mhm.
And I love how you really separate the use of substances from crisis. Because
Mhm.
I think a lot of times people, because of the stigma, because of the fear, start connecting those two. That if there's any substance use, then it immediately means that there's crisis. And that, being able to really separate those, that many people use substances and don't experience crisis. Many people experience crisis and never used a substance. And that as any kind of trauma and any kind of human service and any kind of trauma informed service, we need to have really well, really sound crisis prevention and response protocols in place,
Mhm.
regardless of whether or not there's substance use, right? That so I love how you pull those apart.
I mean, well, you realize that we've been doing victim service for a long time, and you've seen the gamut. You have seen people who have experienced trauma and do not use substances. You've seen people who use substances and did not experience trauma. And then you've seen the two overlap. And so, really, what we've tried to do is reframe substance use as people the same way we frame other victim behaviors, like people trying to get their needs met. And so, what are their emotional needs? What are their safety needs? And using substances for some people meets those needs at that time.